Canada is ramping up its role in the fight against the Ebola outbreak in West Africa. The Public Health Agency just announced it's sending a second mobile lab and team to Sierra Leone to help control the deadly virus. For more, let's go to Rona Ambrose, Canada's Minister of Health. She joins us in Calgary. So, Minister, tell us about the details of this new mobile lab.
Hi, Mark. We're very proud to be able to send over another mobile lab. This is one of the two mobile labs we have that are highly specialized, that are usually at the National Microbiology Lab in Winnipeg. They have the capacity to go into Sierra Leone, be on the ground with our scientists who will be there as well, and be able to diagnose quickly whether or not someone has Ebola. Of course, that diagnosis is fundamental because not only is this lab so specialized that it can handle the Ebola virus safely, but it can diagnose up to 30 cases a day. Of course, that is fundamental to controlling this outbreak. If we can diagnose quickly, we can isolate those people that have Ebola and we can start to treat them. And that, of course, then leads to the containment of the virus. So we now have a second mobile lab. It's actually on a plane right now, headed over to Sierra Leone. It'll join the other lab that's already on the ground, that it's been there since June. This second lab is going to have another very important task. It's going to be working with Médecins Sans Frontières, Doctors Without Borders, and testing the infectious measures that they and others have put in place in the region to make sure they're working. So they're going to be testing things like protective equipment, face masks. They want to make sure that the infectious disease control measures that are being used by physicians on the ground and other healthcare workers are actually protecting them and working. So we're very proud to send over another mobile lab, and we know it will do a lot of good.
And do you have a sense of how many people will be involved and how much money is being contributed to this effort now?
Well, in terms of humanitarian aid alone, Canada has already contributed over $35 million. In terms of the cost of the lab, that is something obviously that we're absorbing as a cost. But we've also given over $35 million to very experienced humanitarian organizations like the Red Cross, the Red Crescent, and Médecins Sans Frontières, the Doctors Without Borders, that are on the ground doing the good work of exactly that: prevention, containment, isolation, and importantly, treatment. We know that we can save the lives of people with Ebola if we get to them quickly and we treat them. So all of this makes a difference. And Canadians should be incredibly proud of the effort that's being made by Canada and by Canadians on the ground to fight Ebola. We have probably one of the best, if not the best, reputation in the world when it comes to public health response, because our scientists at the National Microbiology Lab in Winnipeg have actually been studying the Ebola virus for years. And as you know, it was our scientists in-house at the Public Health Agency of Canada that developed the vaccine that we have given to the WHO that hopefully will be used at some point, that seems promising in actually fighting Ebola. So we have a lot of capacity, a lot of scientific know-how, and we're applying that, and we have been since April.
There are Canadians with this U.S. case right now that are worried. What would you like to say to Canadians in terms of how well prepared hospitals in this country are for dealing with the day, and it could happen, that there is an Ebola patient in this country?
It could happen. This is an infectious disease, but Canadians need to understand, first and foremost, this is not like the flu. It does not spread easily. It is not a respiratory disease. You can't get it from coughing or sneezing or being in an elevator with someone or even being on a plane with someone. You have to have direct contact with bodily fluids. So even though we see it spreading in Africa, it's spreading because there are situations where we have healthcare workers that do not have adequate protective equipment. We have situations where bodies are not able to be moved appropriately. Infectious control measures are not in place. That is not the case in Canada. We have some of the best hospitals in the world. Every lab, every hospital, even every clinic in this country has proper infectious disease protection measures in place. So if something was ever to land in a hospital in Toronto, Halifax, Edmonton, we would be able to deal with it very quickly. We also, of course, want Canadians to know there actually are no direct flights into Canada from West Africa, but even if people are coming from any of those countries through another country into Canada, not only are there really tight exit controls in West Africa, asking those leaving if they've had any contact, asking them if they're feeling okay. If they're not able to travel out of the country. If they do travel out of the country, when they arrive here in Canada through another country, our CBSA border officials have a pop-up screen on their computer. It pops up and they are supposed to ask the traveler, if they're coming from one of those countries, how are you feeling? Are you feeling sick? Have you been in contact with anyone with Ebola? If they answer any of those questions, they're immediately referred to a quarantine officer who has medical training, and under the Quarantine Act, they're able to immediately take that person and put them into the hospital system.
Sorry to interrupt there, but what happens in a case like Thomas Duncan, though? What if they lie on that questionnaire about contact with Ebola? That was the case with Thomas Duncan. So how do you stop? And we heard from the CDC director today saying that they need to take a hard look at improving the ways of screening travelers. So what do you do about someone who lies and comes to Canada?
Well, there are checks and balances along the way. So let's say someone like Thomas Duncan lied and said he hadn't been in touch with someone with Ebola when we know now that he had and he was infected. Of course, there are other measures in place. For instance, at the border, those questions can be asked again. And as you said, if he lies, there's not much we can do about that. But when he presented at the hospital with symptoms, there should have immediately been a red flag. When he said, I'm sick, I have flu-like symptoms, he clearly did have those symptoms, and he said he was traveling from Liberia or West Africa. Immediately, a physician or someone in the hospital should have said, red flag, this could potentially be Ebola, and he should have been put in isolation. And we're seeing that right now in Toronto. Yesterday, in the last couple of days, we had a patient who was exhibiting symptoms, flu-like symptoms. In the end, it was not Ebola, but with an overabundance of caution, which is the right thing to do, the Toronto hospital immediately placed that person in isolation. And we've had 20 such cases in Canada. All of them tested negative. None of them were Ebola, but it's an example of how the system is working. If the person says they're from West Africa or traveling from West Africa, they've exhibited symptoms, immediately we need to be cautious. We need to get them into isolation, and anyone around them should be alerted to either being put into voluntary quarantine, or we should be monitoring all of their medical histories moving forward. So there's a lot of things in place to protect Canadians. And again, the other thing that's difficult with this one, there's been times with other infectious diseases where we've been able to monitor temperatures at the border. This one's different because, of course, you're not contagious until you're symptomatic. So all the more important that we ask those questions when someone's leaving West Africa, when someone travels through any airport, when someone's coming in through our borders, if they have a passport from any of those countries or they're traveling from those countries, and if they do get sick and they go to a doctor, that all of us in the healthcare system are asking that question, where did you come from, if they're exhibiting any of those kinds of symptoms. I feel that Canada is well prepared. We had not only experience with SARS, but with H1N1. We have a very strong public health system network in place. We have an agreement amongst the provinces where we share all of this public health information on an ongoing basis. So I feel very confident that Canada is prepared for anything.
Minister, we appreciate you taking the time. Thank you.
Thank you.
That's Rona Ambrose, Canada's Minister of Health, speaking to us from Calgary.